Have you ever felt an overwhelming fear of social situations? If yes, then you might be familiar with social anxiety disorder. This is more than just the occasional nerves or awkwardness. It's a persistent and intense fear that doesn't go away and can disrupt everyday life. Social anxiety disorder, also known as social phobia, is one of the most common mental health conditions around the globe. Millions of people from every walk of life experience this intense anxiety and fear. It can impact school, work, and personal relationships, often causing those affected to avoid social situations altogether. This isn't about being shy or introverted. It's a real and serious condition that can leave individuals feeling isolated and misunderstood. Life with social anxiety disorder can be challenging, but understanding is the first step towards managing it. So, what exactly is social anxiety disorder? Let's delve deeper into the topic in the next segment. Social anxiety disorder, also known as social phobia, is a mental health condition. It's more than just shyness or occasional nerves. People with social anxiety disorder experience a profound and persistent fear of social situations. They worry that they'll be judged, humiliated, or embarrassed. It's a fear so intense it can interfere with daily activities, work, school, or relationships. Let's clear up a common misconception. Social anxiety disorder is not the same as being shy. While shyness can be a part of it, this disorder often involves a fear that's out of proportion to the situation. It's a fear that doesn't go away and often gets worse over time. Symptoms can be physical, such as blushing, sweating, trembling, or having a rapid heart rate. They can also be cognitive, causing negative thoughts, fear of embarrassment, or excessive self-consciousness. Now you might be asking, what causes this condition? The exact cause of social anxiety disorder is unknown. However, several factors can contribute to its development. It's akin to a puzzle where each piece contributes to the bigger picture. One potential piece of this puzzle is genetics. Just like hair color or height, social anxiety disorder can run in families, suggesting a role for genetic predisposition. Another piece could be the structure and function of your brain. Certain parts of your brain are responsible for fear and anxiety. If these areas are overactive or function differently, it may lead to heightened anxiety in social situations. And let's not overlook the environment. Your upbringing and experiences might also play a significant role. Childhood bullying, trauma, or even overly critical parents can all contribute to social anxiety disorder later in life. So you see, the causes are multifaceted and often a combination of these elements. How does one know if they have social anxiety disorder? Diagnosing social anxiety disorder involves a comprehensive evaluation by a mental health professional. This process often begins with an in-depth conversation where the individual is encouraged to share their feelings, thoughts, and experiences. The professional will also ask about the individual's history, including their family medical history and any past traumas or significant life events. The main aim here is to understand the depth and breadth of the fear and anxiety. How does it manifest? How often and how severely does it disrupt daily life? The professional may use various diagnostic tools and criteria, including the Diagnostic and Statistical Manual of Mental Disorders, commonly known as the DSM-5. The diagnosis is not solely based on feelings of shyness or discomfort in social situations, but the extent to which these feelings interfere with normal life. It's important to note that a diagnosis of social anxiety disorder is not a life sentence. But is there a cure for social anxiety disorder? While there's no cure for social anxiety disorder, treatments can help manage symptoms. Now let's discuss the common treatments for this disorder. Cognitive behavioral therapy, or CBT, is often the first line of treatment. This form of therapy helps individuals understand their thought patterns, developing a healthier and more positive viewpoint. Exposure therapy, a subset of CBT, can be particularly beneficial. It involves gradually and repeatedly facing the situations that cause anxiety. Over time, this process can reduce the fear response. Additionally, group therapy offers a safe environment to practice new skills, share experiences, and gain understanding. Medication can also play a role in treatment. Selective serotonin reuptake inhibitors, or SSRIs, and benzodiazepines may be prescribed. These medications can help to reduce symptoms, but they're often most effective when combined with therapy. As we delve deeper into the realm of treating social anxiety disorder, one may wonder, what about self-help strategies? In addition to professional treatment, self-help strategies can also be beneficial. Let's delve into a few of these strategies. Firstly, deep breathing exercises can be remarkably effective. When feeling anxious, we often forget to breathe properly, so take a moment and fill your lungs fully, then slowly exhale. This simple act can help reduce feelings of anxiety. Secondly, a healthy lifestyle can contribute to better mental health. Regular exercise, a balanced diet, and adequate sleep can help manage the symptoms of social anxiety disorder. Mindfulness and meditation practices can also be of great help. Engaging in these activities encourages us to stay present and focused rather than worrying about past or future social interactions. Lastly, a self-compassion mantra can be beneficial. Remind yourself that it's okay to feel anxious and that you're not alone in this. Remember, it's a journey and every small step counts towards managing social anxiety. Can social anxiety disorder affect one's physical health? Let's find out in our next segment. Yes, social anxiety disorder can also have physical health implications. This is not merely a condition of the mind, but one that manifests physically, affecting one's overall health. Individuals with social anxiety disorder often experience a number of physical symptoms. These can include an increased heart rate, trembling, blushing, dry mouth, nausea, and even difficulty speaking. It's a bit like having a case of stage fright, but in everyday social situations. What's more, the constant state of stress and anxiety can take a toll on your body over time. It can lead to other health problems like heart disease, high blood pressure, and a weakened immune system. The impact on physical health can also extend to lifestyle choices, as people with social anxiety disorder may avoid physical activities or social gatherings, which can lead to a sedentary lifestyle and associated health risks. So we see that social anxiety disorder is not just about feeling anxious or fearful, its ripple effects can touch all aspects of one's life. Can social anxiety disorder be prevented? While we can't prevent social anxiety disorder with certainty, early intervention can help manage symptoms. Now let's delve into the significance of early detection and intervention in managing social anxiety disorder. Recognizing early signs of social anxiety is the first step towards effective management. These signs can include intense fear in social situations, avoidance of social interactions, or physical symptoms like rapid heartbeat or trembling. If you or someone you know is experiencing these symptoms, it's essential to seek professional help. Early interventions such as cognitive behavioral therapy can help manage symptoms and prevent them from worsening. This therapy helps individuals understand and change thought patterns that lead to anxiety and fearful behavior. Moreover, lifestyle modifications such as regular exercise, a healthy diet, and adequate sleep can significantly contribute to anxiety management. Mindfulness practices like meditation or yoga can also help cultivate a healthier relationship with stress and anxiety. So while social anxiety disorder cannot be prevented outright, its impact can be mitigated through timely intervention. What is the outlook for people with social anxiety disorder? With the right treatment and support, people with social anxiety disorder can lead fulfilling lives. Let's delve deeper into this. Social anxiety disorder, like many mental health disorders, is not a life sentence. There's a wide spectrum of experiences, and many individuals find that with time, therapy, medication, or a combination of these, their symptoms can significantly improve. It's important to remember that recovery doesn't necessarily mean the complete absence of anxiety, but rather learning to manage it effectively. It's like learning to dance in the rain rather than waiting for the storm to pass. Ongoing treatment and support play a pivotal role in this journey. Continued therapy can provide the tools needed to navigate social situations more comfortably. Support groups offer a sense of community and understanding, reminding individuals they're not alone in their experiences. So while there may be days where the world feels overwhelming, remember, progress is a slow dance, not a race. Remember, it's okay to seek help. Social anxiety disorder is more than just shyness. It's a serious condition that can significantly impact one's life. From our exploration, we've seen that understanding this disorder is crucial. It's not something one chooses to have, but a real tangible issue stemming from a variety of causes. We've highlighted the importance of diagnosis, for it's through recognizing the problem that we start the journey to recovery. Treatment options are varied and often personalized, ranging from therapy to medication. Self-help strategies too play a vital role, providing individuals with tools to manage their condition. We've also touched on the correlation between social anxiety disorder and physical health, emphasizing the need for comprehensive care. Prevention, while not always possible, can be aided by early recognition of symptoms and prompt intervention. Looking forward, it's crucial to remember that the outlook for people with social anxiety disorder can be positive, with the right support and treatment. You're not alone. Reach out. Help is available.